I'm Kristen Adams, and today I'm here with Dr. Lou Gallia. Now, Dr. Gallia is starting a new study group focused on one of his favorite disciplines in dentistry, TMD and orofacial pain. So, Dr. Gallia, tell me a few things about your new study group.
Well, I've been in this business for over 30 years, and I've had a lot of experience with TMJ and facial pain. And I found there's a lot of dentists don't know that much about it, and I've been meaning for years to set up a format to educate the general dental community in terms of TMD. And so I've given a lot of lectures over the years, and I finally organized a format where I've got a, starting in April. I originally was going to start in January, but we had trouble getting the ads out. So we're going to have a one-year focused study group. It's going to meet once a month for 3 hours. And it's going to take the students initially with basic sciences through physical evaluation, all of the different treatment modalities. As part of the study session, we're going to have each month have a classic TMD article to go over. We're actually going to have some demonstrations of things like trigger point injections, TMJ intra-articular injections, how the different types of splints, how splints are made. So the goal is, at the end of a 12-month period, to have the students have a pretty good knowledge of TMD in terms of not only assessing their patients, but also providing conservative modalities of treatment.
Fantastic. Wow, that's fascinating. Now, what would you say is the most important thing to remember when treating TMD and orofacial pain?
I think there are two things. One is the ability to recognize when a patient has a problem, and it's usually pretty simple. Let me give you an example. I had this young patient in today. She's 13 years old. She came in referred by her dentist for pain, ill-described pain in the jaws. And as soon as I walked in the room, I made the diagnosis without asking the patient a question, but then I asked the patient where it hurts. And she pointed right here to her masseter muscles. And I noticed by looking at her that her masseter muscles were enlarged. So it was clear to me within 20 seconds of walking in the room, the patient had a history of clenching and grinding and had myofascial pain. That is something that most dentists should be able to identify, but probably once or twice a month I see a patient referred in, for example, for wisdom teeth, and it's not the wisdom teeth, it's myofascial pain. So number one, it's the first thing to help dentists in their practice. They're going to see these patients every day, diagnose simple TMJ problems. And secondly, to give them some idea of when it's safe for them to treat and when it's best for them to refer. Those are the two things.
Fantastic. Thank you so much for making that simple. So those are two great things that you can go back to work with tomorrow and get started on. Now, Dr. Gallia, if members of our dental community want to get in touch with you to join the study group, who should they contact?
Okay, there's a website that has the study group information. It's a long URL. Shall I read it out?
Please do.
Okay.
Please do.
And the case is not important in URLs. It's sactmd-orofacialpainstudygroup.com.
And we'll put that below for you to read as well.
Right.
So one more thing before you go, Dr. Gallia. Why do you want to make Sacramento smile?
Well, our goal, as your goal in terms of our private practice, we want to make our patients happy, and we can tell they're happy when they're smiling.
Absolutely. Well, thanks so much for joining us again today, and we'll see you next time. Keep making Sacramento smile.